Ladies, if you're in perimenopause and menopause and you're having joint pain, aches, just feel like your body is like 90 years old, and this all started in menopause, there are solutions. In this video, I want to get into joint pain, which is very common. In fact, over 60% of women have joint pain, and 25% of them have debilitating pain that interferes with their life. So let's talk about the joint pain. Let's talk about some solutions. If this is something that is happening to you, stick around for this video. So joint pain, believe it or not, it's actually really common for women to have joint pain in menopause. So it's about 60% of women experience joint pain, and about 25% have debilitating pain where they actually can't even really function. They have to stop exercising, stop doing the things that they love because they just feel so uncomfortable. In fact, this happened to me. I'm perimenopausal, as you guys know, and I literally pulled my neck muscle by just getting out of bed. I was shocked. It's like I didn't even do anything that was exciting. I literally just got out of bed and pulled my neck muscle and noticed that I was starting to wake up with aches and pains and just feel like my joints hurt. And starting to have this pain in my wrists, which I haven't had in over 20 years, since my mid-20s. It's fairly common for people to have joint pain. So what happens exactly? Why does this happen? When we go through menopause, we have declining estrogen. And estrogen is the hormone, and I should say estradiol is the most active form of estrogen. But when I use the word estrogens, I'm actually referring to all of them because estrogen actually helps with collagen formation, bone turnover, decreasing inflammation in the joints, in the tendons, and the ligaments, providing lubrication in the joints. Progesterone also affects this. Progesterone actually helps with muscle relaxation. Think about progesterone as kind of the relaxing hormone. So when we go through perimenopause and menopause, then these declining hormones of estrogen, progesterone are interfering with our joints. It's interfering with both bone health, bone turnover, but also the joints, the lubrication, the muscles that surround them get more stiff, so you just don't have that flexibility that you had. And also, long term, you get less bone density. You have issues with bone mineral loss, and even the connective tissue that's around it is affected by these declining hormones. So because of this, then we start noticing that we wake up just stiff or achy, or maybe we had an injury when we were younger, and now we're noticing we're having inflammation. We develop arthritis, osteoarthritis, or rheumatoid arthritis, because autoimmune disease is really common to pop up in menopause due to the immune system being affected by estrogen. It can become a kind of a perfect storm with declining hormones where people notice that they wake up stiff and they remain stiff during the day, but they also are having other perimenopause and menopause symptoms. So let's talk about what can you do, because you're not powerless. There are a lot of options. There are options from a Western medicine standpoint, like medications. So if you went to your doctor, the most common thing they would say to you, first of all, they would probably do x-rays. And then when those x-rays were normal, you might be sent to orthopedics. And unfortunately, not a lot of orthopedic doctors know that musculoskeletal syndrome of menopause is actually a thing. And so they often will say, well, you know, your x-ray, your imaging looks normal, your exam is normal, you probably have arthritis. And you can take ibuprofen and NSAID or Tylenol, you could take something for pain, even there's fancier medications like Lyrica, but ultimately it's not actually going to fix that joint pain because you're just kind of damping the pain. This is something we can totally talk about in a different video, just the lack of education in menopause care too, which is something that's really hopefully going to change in the next 10 years, where more physicians are being educated and understand menopause care. So if you were to come to an integrative medicine doctor like myself or a menopause doctor, we really focus on strategies that lower inflammation, because ultimately lowering inflammation is going to be the best thing for it. So we can do that through hormone replacement therapy. And so let's talk about the natural supplements that you could be taking if hormone replacement therapy is not for you, or you're not a candidate, or you just, choose not to do so. So let's talk about those supplements. So my favorite one, and turmeric has a lot of amazing benefits. So for joint pain specifically, it decreases inflammation. It actually helps with brain health as well, gut health. It actually helps with the gut microbiome to make your gut actually healthier, which is awesome because then it actually affects metabolism. So there is even some data looking at weight loss with turmeric. Turmeric is much more effective if you add black pepper. So black pepper makes it 2,000 times more potent or more effective. So make sure that if you're going to get one that you have black pepper in it, and you want to have between 500 and 1,000 milligrams. And, some people I take this every single day because I love the benefits for multiple reasons, but you could take it if you're having joint pain as an alternative to an NSAID, like ibuprofen. Interestingly enough, turmeric has a lot of great benefits in menopause in general. Secondly, the other one I love is omega-3s. So omega-3, you can get this in diet form if you eat fatty fish or focus on dairy products that can have some omega, or even flaxseed, things that actually have higher amounts of omega-3s. But if you can't, then you could take a supplement. So omega-3 comes with both DHEA and EPA. And so you need to sort of make sure you're having at least 1,000 milligrams. I prefer patients to take 2,000 milligrams. Not only is it great for joint pain and lowering inflammation, but it's also great for brain health, helps with cholesterol. It's good for your diet. So it's actually got a lot of great purposes in menopause, and most people will combine it with even vitamin D because they're both basically absorb better with fat. And so you can actually combine them at the same time with a meal. So I would suggest that you're taking 1,000 milligrams at the minimum. 2,000 would be better if you don't get it in food form. I'm always a fan of talking about food first, and if you can get an adequate amounts in food, then you can also not take this as a supplement. Now, you can track, if you're third supplement that I recommend is collagen. So collagen, there are a lot of types of collagen, but you want to make sure you get a collagen that's actually specifically for joints. So this is Fortibone, which is the one that's the most well studied related to bone health. So many benefits besides just bone, because remember, estrogen depletes collagen production, but also, if you take one that combines with hair, skin, and nails, you'll actually get much better skin health and feel like your skin is a little bit more plump and not losing that volume that you had before. So omega-3s, turmeric, and collagen. There are some other ones that are actually studied for joint pain, but those are kind of my top 3 that I love. So you also want to combine this with lifestyle changes. As you imagine, as we lose bone and muscle both, then both exercising that has cardio and weight training or resistance training is really, really important, because you want to actually stress the bone out a little bit to turn over, to produce those better cells. And you also want to improve your muscle mass. If you don't lose muscle mass, which most of us lose 5% or so per year, then you can that muscle will actually be a great metabolic organ for you and help you with weight loss, but it also helps you from having falls long term. So exercise with both cardio and resistance training critical in your 40s. Other thing is an anti-inflammatory diet. It doesn't really matter which diet you choose. It could be paleo or Mediterranean, whichever one makes sense for you. But an anti-inflammatory diet will go a long way with lowering inflammation both in your joints and your brain, and will be beneficial long run to be able to start kind of incorporating that into your lifestyle. And then lastly, I know this is kind of a cliche thing and people always say, stress, reduce stress, but it is really, really important, because if cortisol is actually up because you're stressed out, it will derail all the success of other things. It affects your metabolism, it affects your sex hormones. It really does kind of difficulty sleeping, gaining weight. There's so many things that it affects. So it's important to make sure that you actually do use stress reduction techniques, walking, reading, meditation, journaling. There's so many great options, but really trying to focus on decreasing stress, while it sounds cliche, is actually incredibly important. So hopefully these tips will help you for joint pain and menopause. If you love these videos, please like and subscribe, share them to your friends. I really want to get the knowledge out there for women who are struggling with perimenopause, because I feel like we're often dismissed by both doctors as well as friends and family. And I really want to make sure that you, as well as any other woman who's in perimenopause and menopause, knows your options, knows the things that are available for you, so that you can make the decision for yourself what's right for you.